I'm not asking for any compensation for doing my job. Just give us a little break for a parking spot.
Nurses were hailed as COVID-19's frontline heroes, but those serving in the intensive care unit at one Eastside hospital say doctors, administrators, and even security guards grabbed the green parking placards issued by the city to essential workers.
You're taking those plaques away from the people who are at the bedside.
And that means nurses got slammed with parking tickets. ICU nurse Letitia Yard first sounded the alarm back in April.
I'm like, we work with COVID patients all day.
Yard received 2 tickets the same day for $115 apiece, alleging she'd parked too close to a hydrant.
I explained in a message, I'm a nurse. They didn't care.
At the time, 2 Pix 11 viewers moved by Yard's plight paid $300 worth of her tickets immediately. The city's Department of Transportation told us back then it had sent 13,200 parking placards to public and private hospitals around the city for healthcare workers. The fallout from the Eastside nurse situation seemed to get a temporary solution. The police department gave you each numbers?
It was issued by the New York Police Department.
Geovanni Perez told us the NYPD assigned hospital nurses code numbers they could put on their dashboards, along with a copy of their hospital ID photo, to park near meters during their 12-hour shifts without getting tickets.
They type that number in, it'll come up.
And Perez said nurses were left alone until the COVID numbers dipped temporarily several months ago.
They are giving us tickets. They don't care that they see our badge in the window. And COVID's not over. And the numbers are rising.
Perez sent us an advisory stating the city's parking accommodations for essential healthcare workers were being extended to December 31st, 2020. He said he's paid $500 out of nearly $1,000 in penalties.
A big slap in the face, a huge slap in the face.
Pix 11 contacted City Hall, and the mayor's deputy press secretary, Laura Fair, got back to me. Quote, we have worked with hospitals and workers to dismiss over 2,000 tickets so far, and we are continuing to explore potential solutions for other cases that have been brought to our attention. Pix 11 learned nurses who challenge a ticket will often need a letter from the hospital confirming the times they worked. Some say they're tired of the back and forth with the Department of Finance.
Leave the nurses alone.
I'm Mary Murphy, Pix 11 News.